Velaglucerase, also known as Vpriv Vial, is used to treat Gaucher disease by replacing a missing enzyme called glucocerebrosidase. This medication helps improve blood, bone, liver, and spleen problems caused by Gaucher disease. It's important to note that velaglucerase does not correct the genetic problem, and treatment must be continued for life. The recommended dosage and timing for taking Vpriv Vial will depend on the individual's specific condition, so it's essential to follow your doctor's instructions carefully. When taking Vpriv Vial, it is usually administered slowly through a vein over the course of an hour, as directed by your doctor, typically every 2 weeks. The dosage and frequency of administration will vary depending on your weight, medical condition, and how you respond to the treatment. If you are administering this medication to yourself at home, it's important to carefully follow the preparation and usage instructions provided by your healthcare professional. It's important not to shake the solution, and it may contain a few white particles, so be sure to visually inspect the product for any other particles or discoloration before use. Safely store and discard any medical supplies as directed. While receiving the medication, you may experience side effects such as headache, dizziness, fainting, weakness/tiredness, nausea, or high fever. If this occurs, your doctor may pause or slow down the infusion. Be sure to inform your healthcare professional immediately if you experience any of these symptoms during treatment. Your doctor may also prescribe other medications to prevent these reactions from happening again. It is important to communicate with your doctor if your condition persists or worsens. Blood, liver, and spleen problems typically improve within the first year of treatment, while it may take 2 to 3 years of treatment to see the full benefit for your bones. Some common side effects of Vpriv Vial include fever, headache, nausea, dizziness, abdominal pain, back/joint pain, weakness, tiredness, or redness/pain/itching/swelling at the injection site. If any of these effects persist or worsen, notify your doctor or pharmacist. It's important to remember that Vpriv Vial has been prescribed to you because your doctor has determined that the benefits outweigh the potential side effects. Many people using this medication do not experience serious side effects. Although rare, a very serious allergic reaction to Vpriv Vial may occur. Seek medical help immediately if you notice any symptoms of a serious allergic reaction, such as rash, itching/swelling, especially of the face/tongue/throat, severe dizziness, or trouble breathing. This is not an exhaustive list of potential side effects. If you notice any other effects not mentioned, contact your doctor or pharmacist. For those in the U.S., you can call your doctor for medical advice about side effects or report them to the FDA at 1-800-FDA-1088 or at www.fda.gov/medwatch. In Canada, you can call your doctor for medical advice about side effects or report them to Health Canada at 1-866-234-2345. Before using Vpriv Vial, make sure to inform your doctor or pharmacist if you have any allergies. This medication may contain inactive ingredients that can cause allergic reactions. It's important to also share your medical history with your healthcare provider before using Vpriv Vial. If you are pregnant, only use this medication if it is clearly needed and discuss the risks and benefits with your doctor. It is not known if Vpriv Vial passes into breast milk, so consult your doctor before breastfeeding. If you are planning to have surgery, be sure to inform your doctor or dentist about all the medications and products you are using, including prescription drugs, non-prescription drugs, and herbal products. Remember to always follow the guidance of your healthcare provider when using Vpriv Vial. It's important to be aware of potential drug interactions with Vpriv Vial, as they can affect how the medication works and increase the risk of serious side effects. Make sure to keep a list of all the products you use, including prescription and non-prescription drugs, as well as herbal products, and share this list with your doctor and pharmacist. It's crucial not to start, stop, or change the dosage of any medicines without your doctor's approval. Vpriv Vial is used to treat a certain type of enzyme deficiency called type 1 Gaucher disease. It works by replacing the missing enzyme in the body. The dosage of Vpriv Vial is based on your medical condition, weight, and response to treatment. It is usually given every other week as directed by your doctor. It is important to receive this medication regularly to get the most benefit from it. The optimal timing for taking Vpriv Vial will be determined by your healthcare provider based on your individual needs. If someone has taken too much Vpriv Vial and is experiencing severe symptoms like fainting or difficulty breathing, it's important to seek emergency medical help by calling 911. Alternatively, you can contact a poison control center for assistance. In the U.S., residents can reach out to their local poison control center at 1-800-222-1222, while Canadian residents can call a provincial poison control center. It is important to undergo lab and medical tests, such as IgG antibodies, while using Vpriv Vial. Make sure to keep all medical and lab appointments and consult your doctor for more details. When using Vpriv Vial, it's crucial to stick to the prescribed dosing schedule. If you happen to miss a dose, make sure to consult your doctor or pharmacist to establish a new dosing schedule. Never take a double dose to make up for a missed one. It is important to store Vpriv Vial in the refrigerator and protect it from light and freezing. Be sure to keep all medications out of the reach of children and pets. When it comes to disposing of Vpriv Vial, it should not be flushed down the toilet or poured into a drain unless specifically instructed to do so. It is important to properly discard this product and it is expired or no longer needed. It is best to consult your pharmacist or local waste disposal company for guidance on the proper disposal of this medication. If you need more help, call your doctor for medical advice. In the U.S., you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.